You remember this term, the freshman 15, the weight you put on during your freshman year away at college. For me, it was a freshman 40. For some Iowans, the COVID-19 pandemic has brought the COVID-15. CDC data shows the state's obesity rate for adults climbed another 2.5% last year, up to 36.5%. That's the seventh highest in the entire country. One state health organization hopes to encourage people to lose that weight by getting more active, and Iowans in 94 of the 99 counties have signed up to do it. O'Brien, Emmett, Winnebago, Fremont, and Wayne counties still looking for walkers for this event. The Healthiest State 11th Annual Walk takes place October 6th, and you can sign up to do it individually or as a group. Our political director, Dave Price, talked with the walk's leader, who said improving your health can start with something just as simple as walking, eating more fruits and veggies.
We don't eat a lot of those leafy greens that everyone recommend, our doctors recommend, and that we know provides a lot of high quality nutrients in our diet. So Iowa has historically been in the lower part of eating fruits and vegetables across the nation. We eat a lot of high quality protein. We eat a lot of corn, potatoes, not so much those, kind of that eat the rainbow concept. We lack in that area. So, part of it is just making sure we have access to those fresh fruits and vegetables, making sure that we're incorporating it throughout our diet, maybe in a different variety than we have in the past as well, and just picking up more than just those potatoes and that head of, that sweet corn too, that we so much love here in the state of Iowa.
Obesity is just one of the things that your life's work is all about right now. And I guess I'm wondering, when you see numbers like this come in, obviously you can't make obesity go away overnight. Does it make you have to come up with a new game plan as an organization? Does it just mean there's more work to do? How do you view that?
Yeah, so I think it's just that reminder of that there's still work to be done, right? And so there isn't quick fixes to any of this. I think we all know how complex health is in general, each and every one of us, and the challenges that we have each and every day to make those healthy choices. And so, our plan is how do we continue to look at the work that we're doing and how do we tweak as we need to, but then how do we use this information as a catalyst to spark what else can we be doing and how can we continue to really work to improve. We do a Double Up Food Bucks program. How do we make sure that low-income Iowans across all 99 counties in the state of Iowa have access to that so that they can be consuming more fruits and vegetables and having access to fruits and vegetables? How do we talk more about our 5210 Healthy Choices campaign that we're working on? And how do we start to change policies that really support so the healthy choice is the easy choice for each and every Iowan that lives in our state?
One of the initiatives you have is just a couple of weeks away now in October to get everybody walking. How does that play into this?
Yeah, so physical activity we know is, a great way for us to support not only our physical, but our mental as well as our social well-being. And so this is our 11th annual Walk of the Healthiest States Walk. We've been doing this for 11 years, and it's really an opportunity to bring Iowans together on one day to celebrate the successes of the last year, but then also to gear us up for the next 12 months and start somewhere, right? So we know that walking is the easiest, most affordable, and accessible form of physical activity that each and every one of us can be doing more of, and encouraging Iowans to get at least 30 minutes of walking in a day.
What can you say for people that's practical in that you have some people who deal with mobility issues, you have some people who just going out on sidewalks is not easy. We're about to hit our cruelly long winter period here where walking can be hazardous out there on the sidewalk. So what can you do to help people get that 30 minutes a day when there's not an easy path to get it?
Yeah, so I think first of all, don't focus on that you have to do 30 minutes at one time, right? So I think it's easy, all of a sudden you're like, I don't have 30 minutes in a day. Well, you probably have 10 minutes 3 times a day that you could get out and just take a walk around the block or walk up and down your driveway. Or if you live in rural Iowa, get out on the gravel roads. We are so fortunate in Iowa, we have so many access to trail systems in our state. Take advantage of those opportunities. I grew up in a small rural community myself. I didn't have sidewalks on the farm, but we used used the long lane that we had, or we used the gravel roads that were near us. So there's different ways that you can incorporate physical activity, even just moving within your own house, making sure that you're getting up and moving around. If you are, someone that is a shut-in in a community, that you're getting up and not just sitting in the chair watching the television or sitting behind your computer all day. So don't think of the big of what you want to accomplish. Think of the small steps that you can take to actually build up to even reaching that 30 minutes a day.